My name is Dr. Sarwar Chaudhry. I'm a pulmonologist and sleep physician. I'm going to talk about insomnia today. First, we will learn what is insomnia and how the different people have got different sleeping habits. Then the different types of insomnia and how we classify them, and what symptoms in particular people suffer from, what are usual underlying reasons for secondary insomnia, and any investigation that's are required to diagnose insomnia. In the end, we will talk about the treatment of insomnia. Insomnia is a difficulty with sleeping. So it can be difficulty sleeping in initiation or maintaining sleep, or people waking up during the sleep later and having difficulty falling back to sleep again. So it is a very common disorder actually, and many of us do suffer from insomnia periodically, lasting for sometimes just for a few days to sometime a week or two. In terms of insomnia, we need to understand some people have got different sleeping habits. The sleeping habits of different persons can be related to the duration, which can vary. Some people need sleep, the majority of people need sleep between 7 to 8 hours in 24 hours or every night. But some people need as little as 5 hours sleep or 24 hours, and some people need more than 10 hours or so to have a feeling of sufficient sleep. So that's in terms of the duration. Also, the normal behavior is different. Some people are early bird risers or early risers. They wake up early in the morning and they go to bed early too. And on the other hand, some people are late risers. They tend to be awake during most of the night and then sleep earlier in the morning until they have sufficient sleep. We can also develop different type of behaviors regarding sleep, like some people who are working in a noisy environment, they are able to sleep in the noisy environment a lot better as compared to many other people. Or they would have superficial sleep if their work required them to be on call or at work for longer duration. In terms of the types of insomnia, we can divide into acute insomnia, which lasts for less than 4 weeks, and chronic insomnia, where symptoms usually last for more than 3 months. We can also classify insomnia into the primary insomnia disorder or secondary insomnia disorder. Secondary insomnia is where the people have got underlying health issue as a reason for insomnia, like someone may have an infection or thyroid problem or diabetes or mental health problems. So these are secondary insomnias. As compared to the primary insomnias, they do not have any obvious medical or mental health reason behind the insomnia. Symptoms of insomnia, obviously these people have difficulty with sleep. Some of them, they have predominantly early initiation in sleep problems where they find difficult to sleep. Some people have difficulty with maintenance, meaning they will wake up frequently during the night and may not have enough sleep. And on the other hand, some people have issues with later in the sleep, when they wake up after having initially good few hours of sleep and then unable to sleep afterwards. Insomnia disorder would have significant impact on someone's daytime health. It can make them more tired, sleepy, as they would have not had enough sufficient sleep. It will delay their cognitive and physical responses to the different problems. It can affect their memory significantly sometime, and it also can lead to development of chronic mental health disorder like anxiety or depression, or at least can make it worse if some individuals would have those disorders. Now, talking about reasons of insomnia, why someone develops insomnia while other person don't. We don't know really. We do know that people who have issues in the family regarding sleep, they are more likely to have sleeping issues. We also know that there are people who have chronic physical health problems, mental health problems. They're more likely to develop chronic insomnia. People who've got post-traumatic disorder of some kind or difficult social circumstances are more likely to develop insomnia. If insomnia remains untreated, it can lead to further complications, not just associated with sleep, but also develop many times in depression or anxiety or both. We know that it can increase the risk of hypertension, which increase the risk of heart attack and stroke later in life. And people have a lack of energy and may not exercise well, and can lead to obesity and further complication of obesity. Insomnia is primarily a clinical diagnosis, meaning a doctor will go through your symptoms and analyze any associated risk factors, and many times we can make a diagnosis based on that. There are certain investigations that we may do to rule out the secondary causes. Now, some breathing-related sleep disorders can cause insomnia too, like obstructive sleep apnea, cataplexy, or parasomnias. And in some cases, we may advise patients to have a full diagnostic sleep study to determine any other disorder which may be complicating the primary insomnia disorder. In terms of the treatment, we can try to discuss in two different ways. People who have got acute insomnia due to any medical or mental health disorder, it is important to treat that adequately by medication. And that can be antidepressant or anti-anxiety medication or benzodiazepine, which we simply call the sleeping tablets, which helps you to get to the rhythm. And in the meantime, hopefully the physical or mental health disorders are controlled and the patient will go back to the normal sleep pattern. Sleep hygiene is also very important. In terms of chronic insomnia, it is very important to attend to the sleep hygiene. We'll discuss sleep hygiene in a separate video in details, but what it means is basically following a set schedule of sleep, avoiding daytime napping, so you don't feel you feel tired and sleepy at night time. Avoid screen time in the evening. Avoid those medications which may make insomnia worse, or avoid heavy meals or caffeinated drinks before or in the evening, so that you can have a better sleep. In terms of medication, we can still use medication for anxiety or depression if someone has got those disorders associated with insomnia. We can use melatonin, which enhances sleeping initiation. There are a few other medications specially designed for insomnia which can be used in a small number of people. So if you have got any symptoms suggestive of insomnia, you could contact your nearest sleep physician for the proper assessment and investigation and management.